Now we continue with the back transporting points, bladder 20, Spleen Shu. Bladder 20's location is 1.5 Jun lateral to the posterior midline on the level of the lower border of the spinous process of the 11th thoracic vertebra, T11. How to find? In a seated position with the arms hanging down, the spinous process of T7 is approximately on the level of the inferior angle of the scapula. From there, count down 4 spinous processes to the spinous process of T11. Bladder 20 is located on the level of the lower border of its spinous process and at the highest point of the paraspinal musculature. Or locate the articulation of the most inferior rib, which is the T12, and palpate in a superior direction to T11, or use the lumbar spine for reference. Located on the same level are Do6 on the midline, a point of EXB2, 0.5 Jun lateral to the midline, bladder 49, 3 Jun lateral to the midline. Needling 0.5 to 1 Jun obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needle retention. The needles can be secured with tape. Caution is pneumothorax. For the action and indication, bladder 20 tonifies the spleen, Qi, and Yang, regulates Qi in the middle, and raises Qi. Transport dampness, holds, and nourishes the blood. Special features, bladder 20 is the Back-Shu point of the spleen, major point for tonifying the middle, especially for spleen deficiency syndromes. Use moxibustion or tonifying needle techniques for nourishing the blood. Bladder 20 is a very important point among all the back transporting points. It is a major point to tonify the spleen and stomach and invigorate the spleen function for transformation and transportation. It is used in any spleen Qi deficiency pattern with symptoms of tiredness, loose stool, no appetite, abdominal distension. Combined with bladder 21, it provides a powerful tonification of the root of the post-heaven Qi, that is stomach and spleen, and is used to tonify Qi and blood when a person is physically and mentally exhausted over a long period of time. By tonifying spleen Qi, this point also resolves dampness and phlegm, which derive from dysfunction of the spleen activity of transformation and transportation of fluids. Bladder 20 is therefore used in practically every condition with chronic dampness or phlegm. By tonifying spleen Qi, bladder 20 also nourishes blood, as the spleen is the origin of blood. This point is therefore very much used to nourish blood, often in combination with bladder 23, the kidney Back-Shu. In this case, the point should be tonified or direct moxa applied. As it tonifies spleen Qi, it strengthens two other aspects of spleen Qi. It leaves spleen Qi when this is sinking and causing a prolapse or simply a bearing down feeling in the lower abdomen. By tonifying spleen Qi, it stops bleeding and caused by deficient spleen Qi not holding the blood in the vessel. When it is used for excessive menstrual bleeding, it is combined with bladder 23. In conclusion, bladder 20 is a very important point to be reinforced in nearly all chronic diseases when the person is very depleted in energy. Summary of function, bladder 20 tonifies spleen and stomach for the poor appetite, tiredness, loose stool, weak limbs, abdominal distension. It resolves dampness, the feeling of fullness, feeling of heaviness, sticky taste, jaundice, feeling of heaviness of the limbs. It regulates the intestine, the abdominal distension and pain, borborygmi, diarrhea, undigested food in stools. It lifts the spleen chi and stops bleeding for the prolapse of stomach or uterus, bearing down feeling in the lower abdomen. It nourishes blood, very important tonifying point. Spleen chi deficiency may result from constitutional deficiency, irregular diet, excessive thinking or overwork, insufficient or excessive exercise, or prolonged illness. Deficiency of spleen chi and impairment of the transportation and transformation function will give rise to such symptoms as lassitude, lack of appetite, diarrhea with undigested food in the stools, and childhood nutritional impairment. And bladder 20 is an essential point in the treatment of such disorders. Bladder 20 is specifically indicated for the symptoms of remaining thin despite such much eating. The treatise on the spleen and stomach by Lee Dong-won offers an interesting discussion on the various possible relationships between appetite and obesity or leanness, saying that if the spleen and stomach are both excess, food intake is large and the person easily becomes fat. Secondly, if both are deficient, there is either inability to eat, a person is thin, or alternatively, a person easily becomes fat, yet weak. Despite a low food intake, this latter condition being due to accumulation of phlegm dampness. Okay. And thirdly, there are also cases of thinness despite large food intake. In this case, fire hidden in the chi paste in the stomach result in a large food intake, while spleen vacuity leads to withered flesh. Okay, this is known as food liquor. Shui has said large food intake is not incompatible with weak muscles. The apparently contradictory condition of spleen deficiency with a large appetite is often encountered in clinical practice, and in explanation of hidden stomach fire with spleen chi deficiency explain this well.